Hormones secreted by the glands of the endocrine system, such as the hypothalamus, pituitary, and adrenal glands, control many physiological functions, including metabolism as well as muscle growth. The production and secretion of these hormones is tightly regulated by feedback mechanisms between endocrine glands that form regulatory axes, such as the hypothalamic pituitary adrenal, or HPA, axis and the hypothalamic pituitary gonadal, or HPG, axis. Endocrine dysfunction can be observed in patients with controlled HIV infection and is considered to be among the potential contributing factors in HIV-associated wasting. It is characterized by disruption of the hormonal regulatory axis and abnormal levels of hormones, such as glucagon, insulin, epinephrine, and glucocorticoids like cortisol, which are involved in regulating the metabolism of proteins, lipids, and carbohydrates. In the HPG axis, hypogonadism, or a low level of testosterone, is still seen in the current era of combination antiretroviral therapy, or CART, with a significant 20 to 25% prevalence among men with HIV-associated wasting. Interrelationships between different axes can be seen here, as testosterone normally promotes insulin-like growth factor 1, or IGF-1, expression and protein synthesis. Decreased levels of testosterone can be associated with decreased IGF-1 levels and increased glucocorticoid levels, which can result in loss of lean body mass and reduced exercise capacity. In healthy individuals, growth hormone release from the pituitary gland triggers the secretion of IGF-1, primarily from the liver. IGF-1 is an anabolic hormone that supports building molecules. It increases protein synthesis and inhibits protein degradation in muscles. In patients with HIV-associated wasting, reduced IGF-1 levels may also be caused by disruption of the GH-IGF-1 axis. In addition, many other factors related to HIV infection, such as chronic stress and increased pro-inflammatory cytokine levels of tumor necrosis factor alpha, or TNF-alpha, interleukin-1, or IL-1, and interleukin-6, or IL-6, may result in a shift towards increased cortisol synthesis in the adrenal gland. The reduced serum IGF-1 levels may lead to increased protein degradation and the loss of LBM that is seen in patients with HIV-associated wasting. The shift in endocrine function towards increased levels of the catabolic hormone cortisol may also contribute to a higher rate of protein degradation and to increased muscle atrophy in these patients.